Today's episode is a little more personal. At 27 weeks into this fourth pregnancy, I made a big decision to switch from planning a birth center birth to preparing for a home birth. I want to share the why behind that decision, the questions I had to process, and what the research says about home birth so that you can feel informed if you're considering your own birth options. Now, for a bit of a backstory, my first three pregnancies were all delivered at The Ohio State University Wexner Medical Center. This was a typical hospital setting for my first three births, but with a midwife care team. And I absolutely adored them. I got to know, like, and trust all of the midwives on that team. I shouldn't say all, but most of them. I met most of the midwives throughout my care there. And I felt like it was the right place for me to be. My first birth was 24 hours of active labor. I actually started in prodromal labor. I was not dilating, and so I had gone in and I was still at the same dilation I was at my last midwife appointment. But I had been laboring for like 8 hours at home all through the night, and they decided to insert a balloon catheter, which helped my body to dilate and to actually respond to the contractions that I was having. After 18 hours of laboring at the hospital and going 2 days without sleep, I opted for an epidural in that first delivery. It is what my body needed to relax my pelvic floor. If you listened to episode, I'm going to make sure I have the right one for you, episode 28, we talked about Kegels and why they're not the answer in training your pelvic floor for pregnancy. Honestly, at the time, I was an orthopedic and sports med PT, but not a women's health pelvic floor PT aligned with that. And I didn't know how to relax my pelvic floor. And it's so funny looking back. I'm like, I wish I had pelvic floor PT, or I had gone through the training that I have now to have helped myself in that first delivery, because my pelvic floor wasn't letting go. I was fighting the contractions. I was tensing up when they were happening because they are uncomfortable. It is intense. And if you don't know how to let your body just accept the surge and let go, then sometimes an epidural becomes the answer. And so anyways, I opted for an epidural at 18 hours of active labor, and I slept for like 2 hours. I woke up and I was fully dilated, fully effaced, and ready to push. And so it was what my body needed. I've heard similar stories for other women during their first deliveries. And so I'm really glad that I was in the hospital setting for that delivery. I will say first-time moms for home birth have a higher transfer rate compared to moms who have had kiddos before. And a lot of that's because it's your first time experiencing it, right? So all that to say, first delivery in the hospital setting, I was glad I was there because I did end up needing a few interventions to help my body along the way. Second child was delivered less than 15 minutes of arriving at the hospital. My husband almost missed the delivery. It was 2 a.m. I was resting and side lying. I had been having light contractions all day at work. I worked until 7:30 p.m. as a physical therapist in sports medicine. And I literally worked through my contractions, but they were light. At the end of my shift at 7:30, I was like, okay, yep, it's time to go home. At 9:30, they picked up. We ended up dropping our daughter, who was a toddler at the time. She was 2. We dropped her off at our babysitter because I figured that at some point through the night, we would be having this baby. And so that worked out well. We put her to bed. She was already asleep, but at 9:30, we transitioned her to our sitter's house, went back home and labored. And then at 2 a.m., I felt a big shift in my pelvis, and I was letting myself like doze off between contractions. I very much wanted a natural delivery. I did not want an epidural. I didn't want an epidural my first time either, but like I needed it. And so the second one, I wanted to be at home for as long as possible because I knew once you're in the hospital setting, it can lead to more interventions because it's just there. It's at your fingertips, right? So I just let the contractions come and was able to literally doze off between them. 2 a.m., woke up, felt a huge shift in my pelvis. And I believe that was transition, where it was like, baby is now fully engaged. I'm ready to push. And I felt that urge. I felt that urge that I could have, just that uterine ejection reflex where your body, it just starts happening, right? It's not an active push. It's just this involuntary auto response of your body being ready to go. So I tell my husband, we have to go to the hospital now. Thankfully, we were like 15 to 20 minutes away, 2 a.m. Nobody's on the road. We made it quickly. He drops me off at the ER. That's how you have to enter in the middle of the night at our larger hospital there. The security guard like wheeled me up. 3 nurses came with us into the elevator with a whole like birth kit in case I delivered on the way to labor and delivery. Skipped triage, went straight to labor and delivery, crawled onto all fours on the table, and was able to let just those uterine ejection reflexes take over. My husband came in the room and he's starting to unpack our stuff, like our first kiddo. We were there forever laboring, and so he's getting out my essential oils, like my bone broth, like all of my things that he knew I would want to have on hand. And then they're like, there's the head. He's like, what? And so then I delivered baby boy, baby number 2 on all fours. And we had to really crank like internal rotation because he was a bigger kiddo and his shoulders did get kind of stuck for a moment. But when you really crank hip internal rotation, so you rotate your shins away from each other, it opens your pelvic outlet and he was able to slide right out. Third delivery, I'm giving you all of this backstory just because I think it's important to understand reflecting on your prior births and making your upcoming birth choices. So third delivery was a little different in that I had premature rupture of membranes at 38 weeks of pregnancy. So I started leaking amniotic fluid, and it had to have been a high tear because it was just a little bit, like little squirts, but with each step, with each squat, each time I would bend down. Happened around 6:30 p.m. at 38 weeks of pregnancy. My midwife was like, get some rest. You're not having any contractions. Next morning, brought our kids to childcare and then went into the hospital and triage. My midwife checked, and yes, I did have amniotic fluid. So they admitted me. And at that point, I wasn't having any contractions. They wanted to start me on Pitocin. I declined. I said, let me just accept the fact that baby's coming now. I had yet to accept that fact. So mentally, I was not in the mindset for moving into labor. My grandmother had just passed away, and I had been planning on going to her funeral like 2 days later or the next day. And so once I let that go of like, okay, I'm not going to be able to make this funeral. This baby's ready to come. And we started nipple stimulation. So I did a breast pump on for 20 minutes, and then I would walk, and then 20 minutes on, 20 minutes off, let's walk. And I just did this circuit for about 2 hours. Contractions did start, and I accepted the fact that it was time. And so we just lightly moved through early labor throughout the day, and then slowly transitioned into active labor. And at 7:00 p.m., I asked them to check me. So my goal was a water birth, and the hospital's rule was that you could not get into a tub until you were 6 centimeters dilated, because if baby isn't low enough in the birth canal, it can actually stall labor and could like move baby back up because of the buoyancy of the water. So we want to make sure baby is low enough and in order to get in. So they check me, and I'm at like a 7.5. So we're like, okay, it's go time. So they start filling it up. I'm like, at this point, now looking back, I'm like, I was in transition. It was at that point where I'm like, I don't know what to do. I don't know what position I want to get in. And prior to this, I had just been very calm. I was like, okay, we're doing this circuit, and now we're going to do this movement-based circuit. And I just had a plan all day. And at 7, I was like all over the place. And so I said, I'm going to go to the bathroom. I'm going to go to the bathroom, and then I'll get in the shower until the tub is filled up. And so I go to the restroom while my bag of water fully pops. And if in my second birth, my bag of waters had fully popped upon going into the labor and delivery room. And that's when he was born, like right after. So I knew, okay, this baby's going to start coming quick. And I started to deliver the head on the toilet by myself and yelled for my husband to come in the room. 7:00 is right at shift change. So our nurses are out in the hallway talking. My midwife I had been with all day had just left. The next one was coming. And so my husband ran and got the nurses. They come in. They're the ones calling the midwife, the other ones like getting towels and gloves. And they're asking me if I can walk to the bed. And I said, absolutely not. Like the head is between my legs at this point. And so I stood up from the toilet and I'm in a slight squat. The midwife comes in. She said, okay, I want you to just squat a little bit more on this next contraction and we're going to get that baby out. And my third kiddo arrived, standing in the bathroom of the hospital, of my labor and delivery room. And so I reflect back on this to tell you that, that first birth, I'm glad that I was in that hospital setting, but my second and third, I really could have been anywhere, right? And yes, we don't know how each birth is going to unfold, but looking at your own medical history is really important to know what your body typically does in response to labor, right? So we moved after our third kiddo was born. We moved about 2 hours away from the city into a very rural area. And so my birth options changed. I had to change my care team. I unfortunately could not stick with that midwife group who I had come to know really well in Columbus. And I chose a birth center. So there is a birth center about an hour from my home. They have a midwife team. It was the most similar model to what I experienced in Columbus. However, it was an hour away, and I knew none of the staff going into this. Well, I started my care with them. And every single appointment through 27 weeks of pregnancy, I saw a different provider. And the continuity of care simply was not there. It was clear when a new provider would come in to see me for the subsequent visit that they didn't chart review. They didn't know why I was there. Why am I there now? And all three of my first births were in Columbus. It's like, because we moved, right? And I just left each appointment feeling really frustrated, feeling like I didn't learn anything new about my body or how to optimize my outcomes in this fourth pregnancy. I just heard baby's heartbeat, got my blood pressure, and kind of became frustrated because I had to re-explain my story each time, right? I ended up, after my 24-week appointment, starting to think about home birth. And in the meantime, I am a orthopedic and pelvic floor physical therapist with my own private practice. And I'm seeing patients who have gone through the birth center practice, who have gone through our local rural hospital, and who have gone through home birth. And I'm hearing their stories. And more, I just started feeling this tug on my heart that was saying, maybe home birth is for you. And I will say, previous to that, I would be, I don't know if against home birth is the right thing to say, but I was very hesitant about it because I was trained in the typical medical model, right? That's where I went through schooling. And you just kind of have these stories in your head of like, that's irresponsible. Why would you choose not to be where all of the best care is located? But as I started to learn more, it's not always the best care in the hospital setting. And unfortunately, we were seeing a lot of areas being understaffed. And just as with my story of my third kiddo and there being a shift change and there almost wasn't a midwife there for delivery, when you have a home birth, that team is there for you and you only. And you get to know a team of about 3 midwives throughout your prenatal care with the practice, with the group that I am going with. They know me well. And they're with you during that labor and delivery. They're not leaving because their shift is over and it's time for them to go home. They're making sure they're with you until that delivery is complete. And I just really started to crave that and to want that. I will also say that I value a holistic approach to care, meaning we're looking at supplements, we're looking at diet and nutrition. And I know a lot as a holistic orthopedic and pelvic floor physical therapist, but I don't know it all. And I recognize that. And I want to leave my medical provider appointments feeling like I've learned more, right? And what was funny is that in a few of my appointments, I was giving them recommendations on like why I was taking the supplements that I was taking, and the provider was taking notes. This was with the birth center group. And I just was reflecting, I'm like, I'm so excited that they're wanting to learn more, but I want to walk away learning more because I'm paying you, right? And when I met with these home birth midwives, they immediately had recommendations on supplementation for reducing risk of premature rupture of membranes. That was something that had never been brought up previously to me, to help strengthen the amniotic sac and the uterine lining. And I was like, okay, awesome. And so just having that increased valuable insight was huge to me. And that's really what I was seeking. And so for me, it was What made me switch care was the personal reasons of wanting to feel trust with my provider and not feel like I'm seeing a different person every single time and not knowing who's going to be at my actual birth. I really liked the idea of just getting to know 3 providers really well and having trust in them so that when they arrive to my birth, we can move through that process together. Alignment of values with that, and then a desire for just more education and more understanding of how to support my body holistically as I moved through pregnancy. And then I, at the time, wasn't sure if I could switch care, right? I reached out to the home birth team at around 24 weeks of pregnancy. They said they actually could take me on as a client, that it is actually very common for patients to switch in the 2nd or 3rd trimester for similar reasons as what I was experiencing, just frustration in their care process up to that point in pregnancy with their current team. And when I brought this up at my 26-week appointment, I was actually just shy of 27 weeks. So my about 27-week prenatal appointment, when I brought it up to the nurse practitioner, she was understanding. She validated my reasons for feeling the way I was. And she concurred that I was low risk, that I was a perfect candidate for home birth. And so I really appreciated the ability to have an open conversation and not feel shamed for making a different choice. I very much left that appointment feeling confident in what had been placed on my heart to transition to a home birth. And I did not think that that was the way that appointment was going to go. So my anatomy scan was all clear. My blood pressure had been looking great. I had no prior comorbidities or concerns from like an overall health standpoint. So looking at all of those key factors and having that conversation with my current care team when I was in the hospital-based setting was really helpful in making that choice to transition to a home birth too. So I encourage you to ask those questions with your provider. Am I a good candidate? And just seeing what they say. Your provider may not be as open as mine, and that's okay, but at least having that conversation. So I will say with that, it is never too late to switch. Now, is home birth safe? This is the biggest question that my husband and I wrestled with, and that I previously would have said no, to be honest. And as I dove into the evidence and listened to more and more resources in this category, I learned that for low-risk pregnancies, a planned home birth with a qualified midwife has better outcomes than birth centers and hospitals for maternal health and fewer interventions. So risk of C-section, episiotomy, epidural, all is much lower in low-risk women whenever they have a planned home birth with a qualified midwife. The research also shows, including Cochrane reviews, that maternal satisfaction is often much higher than a home birth. And I can totally attest to that just in my experiences in the hospital setting. Even though I was very happy with how those births unfolded for my first 3, I did have to advocate for myself. I did have to decline Pitocin when it was immediately given. And this was with a midwife group that I really trusted and valued their opinion with. Knowing that maternal satisfaction is higher in home birth was also something that made sense to me. Now, infant outcomes, I think this is something that goes through a lot of people's mind. Well, I want to be where, the best care is possible for my baby if they need a NICU transfer, for instance. And so this is where I bring back up first-time motherhood, right? For first-time moms, the risk of needing to transfer either post-delivery or during labor is higher for first-time moms compared to subsequent mothers. I believe the rate is 7%, 7 to 20%, depending on what you look at. But for moms who have had children previously, the transfer rate is 1 to 2%. So that's a big difference, right? And so for me, I'm very glad that my first kiddo was at the hospital setting because interventions were there. Now, could that birth unfolded differently had I been home? Absolutely, it may have. I'll never know, right? But knowing because of my history with my second and third births that the risk for any transfer needing to be had is very, very low, 1 to 2%, okay? So looking at your own birth history, very important there. If you are a first-time mother, just weighing those pros and cons and making sure you have a plan in place. Now, what about emergencies? What if a transfer is needed? Transfer plans are discussed with midwives during your prenatal care. And so I've already had those conversations with my home birth midwives of When would you transfer? What red flags are you looking for? And midwives are trained to identify the red flags early. It is very rare for a home birth transfer to be emergent. Usually these transfers are non-emergent, such as a stalled labor or, babies experiencing multiple heart rate decels. It's clear that we might need to be in a hospital setting, like they transfer early. If a mother has a request for pain management, so let's say it's a first-time mother, labor has stalled, she feels like she needs pain management, it's been a long labor, like my first one was, they may transfer to the hospital. So most transfers are non-emergent. Now, who qualifies for a home birth? Typically lowest risk pregnancies. So women who do not have preeclampsia, they do not have uncontrolled health conditions, they do not have uncontrolled diabetes. Now, do higher risk mothers choose to still deliver at home? Yes, there are women who choose to have home birth deliveries of twins, of multips, of having multiple kiddos at one time. There are breech vaginal deliveries at home. So because you have a risk factor doesn't mean you're automatically discounted from a home birth. It just means that you need to make sure you have the right provider and that your risk may be higher for a transfer, right? It is so important, though, that you are searching for a skilled, licensed midwife. Do your research. Ask around in your community. So I asked 5 different mothers who I know that have delivered with the home birth midwife group that I am going with, and they all had fantastic experiences. And so that is extremely important. I also talked with my hospital-based care team, and they were aware of that home birth midwife group and had great things to say about them and knew their skill level. So talking from professional to professional, but also from patient to patient, was really huge in making a decision for trusting my home birth provider. So what about pain management? Obviously, non-medical pain strategies are going to be very important if you're choosing to birth from home. And this is my goal in the hospital setting every single time. So for me, it wasn't a con to not have access to an epidural with a planned home birth. So non-medical pain strategies look like movement. So like those movement circuits I was mentioning having done during labor with my 3rd kiddo, done that every single time. And that is a great way to help your body through labor. Hydrotherapy can also help. So standing in the shower, letting it beat on your back, getting into a birth pool when you are far enough into your labor. Breath work, choosing to tap into your parasympathetic nervous system through that nice diaphragmatic breathing, which is something we work on when I'm training with patients one-on-one during pregnancy or through my Holistically Well pregnancy program. Doula support can be great if you want some extra hands and support and pushing on pressure points, acupressure points, or giving you ideas as you're moving through labor. Positioning, there are positioning techniques such as sideline cowgirl position, where we have a big peanut ball between our knees and our one hip is slightly internally rotating, our pelvis is shifted forward. That can help if baby is asynclitic or stuck in a certain position. And as baby shifts and moves, that makes labor less uncomfortable for you. So there's all of these positioning strategies we could use as well. Gripping a comb can also be helpful. So literally gripping a hair comb in your hand, your nerves, your brain to muscle connection is going to feel the input of those combs into your fingertips. And you're going to be less likely to feel the discomfort that's happening from a contraction. And so we're just kind of tricking the brain. It's like if you bump your elbow and it hurts, you hit your funny bone, you rub it, right? And it makes it feel better because our brain starts to feel the rubbing sensation versus that shock of discomfort, right? Essential oils can also be really calming. So epidurals obviously aren't an option at home, but this is usually part of the intentional choice, is not wanting that to be an easy option to reach for, but instead leaning on these other non-medical pain management strategies. So the final question, that I've been asked a lot about this switch is, how did my husband and family feel about it? Personal dynamics are hard. And honestly, it needs to be, number one, a conversation between you and your spouse. Now, my husband knew that I was literally losing sleep about this decision. It's going to make me feel emotional. But really, like after that 24-week appointment, I had like 2 weeks where I just was not sleeping. I'll say two, and I don't know that I mentioned this before, but I was having a fear of like even making it to the birth center, of having a car birth. We live on backcountry roads in a rural community. Then you have to get to the interstate. The interstate that we would have to go on was under construction. And we would be going right around Christmas time. And so you just don't know if there's going to be snow on the road or what the conditions may be like. So I was literally having like nightmares about making it to the birth center and having to have a car delivery and just the safety of that, that obviously if there's construction on the highway, which I've had to drive that route for various things recently. And I was just picturing myself in labor there and knowing like if that was with my second kiddo, I wouldn't have made it in time and I would have delivered in the car. And, that's not safe as somebody's driving and you're not buckled in and all of those things. So I really just had to wrestle through the emotions and the decision making myself. My husband was seeing me wrestle with all of that, and he knew how seriously I was taking this decision. And so when I came to a conclusion, he was like, I trust you, and I support you, and this is what we'll do then. But we did have a lot of conversations about the questions I just went through and how does that look, right? And he was definitely hesitant about it. It wouldn't have been his first choice if he were to say that. He would tell you. But he also knew that I did my research and he trusts me and he knows that I work in this field and that I'm hearing birth stories every day that I'm in office. And everything was pushing me towards a home birth. And I'm not telling you what to do. You need to be able to reflect on this yourself and move through the emotions yourself. But if you have something put on your heart and in your gut and you can't get it out of your head, a mother's intuition is so powerful. And so our families, our friends, they know that too. They know that I take this seriously. And so I think the biggest thing is moving through all of it yourself first, so that when you do tell your family and you share with your family and your friends about it, that you feel confident in your decision and you don't allow their thoughts or opinions to sway you, because it may be a different decision than what they feel like you should do, and recognizing that's okay. They have not been put in the position that you're in. They have not experienced the other labors that you've experienced or the postpartum. And so I just share that from a very personal place of this is your birth. It's you and your spouses, you and your partner's child. Number one, making sure that you feel united on that decision and you can move through all the thoughts and emotions as we did over the course of about a month before you come to a conclusion that then you feel confident and good in. And then you can share that from a place of unity. So getting back into some science-backed perspectives here, key studies indicate that a planned home birth in the United States with a licensed midwife leads to fewer interventions and better maternal outcomes for low-risk women, point blank, okay? Safety improves significantly when the woman has been integrated into the healthcare system previously. And so the nice thing about having done my first 2 trimesters of care, most of my second trimester, and all of my first trimester with a hospital-based midwife team, is that the hospital has all of my medical records on hand. They know my blood type. They know what my anatomy scan looked like. They know what baby's growth rate was like. They have all of my blood pressure readings. They have my initial blood work, right? They have all of that on hand. So if a transfer were to be needed, either to the higher level medical system that's about an hour away, or to the more local rural hospital that's about 20 minutes away, they can access all of that because they're on an electronic medical record system. It's called Epic, the ones that are used locally here. And it's actually the same system that Ohio State, where my previous 3 births were, but that they utilize as well. And there's something called Care Everywhere that they can go into. And even if it's a different hospital system, they can pull in your records from those other places. And so that was just really comforting and reassuring to me of, if I do need to transfer, I'm not unknown to the medical system, right? They're able to pull my records, pull my chart, and it just makes it that much easier for, again, knowing my blood type if I were to hemorrhage or need blood transfusion after delivery. Again, I don't foresee that happening, but I am somebody who likes to check mark all of the boxes, right? So planning ahead, it can be nice to have established care with the hospital that you may transfer to in the event of an emergency, right? In the event that a transfer is needed. that they have your medical records on file, okay? It's not an absolute must, but it definitely improves outcomes with transfers if that were to be necessary, right? And then asking your midwife too, do they have relationships with the local hospitals? And mine does. They've made transfers to each of the hospitals that are local to me, and they have a good rapport with the staff there. And so again, that was really important to me just for ease of transfer in any kind of emergent situation, because we want to hope for the best, but also plan for if something were to happen. Again, it's unlikely, but it's important to have those plans in place. It's important to note that home birth isn't for everyone. I always said in the past that it wasn't for me, even though I take a very holistic approach to everything, but now it is for me. Now I do desire this, and I feel like it is the best informed choice for me in this fourth pregnancy. And so knowing that your perspective can change, your plans can change, and it's never too late to change, no matter how far in pregnancy you are. I have a patient who transitioned to a home birth care team in her third trimester. And so I was like, okay, I can do that at the end of my second. It's okay. This decision just feels very aligned with my values as a holistic orthopedic and pelvic health physical therapist and mother. I really enjoyed going through each of my prior birth stories with you too, to understand I had incredible hospital birth experiences too. I was planning a birth center birth, but opting for a home birth. And so with this fourth one. And so, you can have your desired birth outcomes no matter what setting you're in, but taking everything into consideration for you personally and just what feels best is so important, because you need to trust your care team. It's important to ask questions. It's okay to pivot. And ultimately, you need to choose the environment that feels safest and most supportive for you. My first 3 births, that was a hospital setting, but in this fourth, it's desiring and craving a home birth setting, and it's okay to change, right? So I encourage you to advocate for yourself, to ask questions, to research your options, and to trust your intuition as an expecting mother. If you have your own stories of switching care, or if you're battling different birth settings, feel free to DM me at Dr. Kayla Borchers. No question is off limits. No topic is off limits. This type of maternal care is so important to me. And as you can tell, I've wrestled with my own emotions surrounding not only the personal side of things, but digging into the research professionally. And I'm just here to talk if you need somebody to talk to. If you are looking for support in preparing your body for birth, I will say this is a huge thing that is very important if you are planning a home birth or if you're desiring an unmedicated birth in general, no matter where you're planning to deliver. Birth prep is so important. I mentioned in my first delivery, I wish I had the knowledge that I have now, or that I had for my second and third, and now this fourth delivery, because planning ahead means so much and reducing your need for interventions, okay? And reducing your need for transfer, right? So anyways, I walk you through all of that birth prep in my Holistically Well Pregnancy program. You can use the discount code POD20 to grab 20% off. I'll put the link in the show notes. Again, that's my Holistically Well Pregnancy program. We move through breath work, pelvic floor prep, perineal mobilization, functional strength training, and mobility training to prepare your body for birth. All right, so that is in the show notes for you. Use code POD20 for 20% off. Thank you for tuning in. Thank you for letting me share my story. And as always, just thank you for being part of this community. If something stood out to you today, drop it as a review. Leave us a 5-star review. Let me know what stood out most to you. And it really helps center the conversation here on Holistically Well.